Hey everybody, my name is Kaylee, and in today's video we'll be talking about a case study on chest trauma. If you are new to my channel, welcome. If you have been here before, you know I post case studies on various topics helping you prepare for the next Generation NCLEX. In today's video, we'll be going through a case study from bootcamp.com, who is kindly sponsoring this video. At the end of the video, you'll have the opportunity to gain access to a free 3-month subscription to the site. Alright, let's get to the case study. Alright, so our case study today, let's first look at the question. Drag the top 3 client findings that require immediate follow-up to the box on the right. The client arrived at the emergency department via a friend's private car following a motor vehicle collision that occurred 15 minutes prior to arrival. The client appears anxious. He reports he was the driver of the vehicle and was involved in a head-on collision with airbag deployment. He was traveling 45 miles per hour and states he was alone in the car at the time of the accident. Let's pause for a second and look over what we read here. So he was involved in a motor vehicle collision. It was a head-on collision with airbag deployment, and he was traveling 45 miles per hour, which is pretty significant. Right now, based on what we've read, we don't have any findings that we've read yet. So we know that this is just background information. And as we continue reading this case study here, we'll stay tuned to any findings that require follow-up. He denies any loss of consciousness, but does not remember if he hit his head during the impact. The client reports severe left-sided chest pain that is described as sharp with shortness of breath. He states, "The left side of my chest has been hurting where the airbag hit me. I also started to feel short of breath after the accident, and it seems to be getting worse." He is tachypnic with an oxygen saturation of 92% on room air. Breathing appears slightly labored with curly lung sounds on the right and absent lung sounds on the left side. He has a 4 cm by 4 cm superficial abrasion to the left chest wall with no bleeding noted. Okay, so let's break this down because it is a lot of information. So we can see that he has severe left-sided chest pain, it's sharp, and he has shortness of breath. Along with that, he is tachypnic, has an oxygen saturation of 92% on room air, labored breathing, and absent lung sounds on the left side. Let's go to vital signs. Temp is 98.6 Fahrenheit. That is within the normal range. Our pulse is 132, which is a little bit elevated. Respiratory rate is 26, which is also elevated. Blood pressure of 102/84, that is a bit hypotensive. And he's 92% on room air. Okay, so one thing to note here when you're taking the NCLEX is that whenever oxygen is 92% or below, that is low on the NCLEX. So you'll want to alert that that is an abnormal lab value, and you'll likely be wanting to start oxygen for that patient. Because we are most concerned with his respiratory assessment, let's start with that. He is dyspneic, tachypnic, lung sounds clear on the right, they're absent on the left, and he has tracheal deviation to the right side. So definitely some concerning respiratory findings. Cardiovascular-wise, our JVD is present. S1 and S2 is normal or present. No carotid bruits, bilateral pulses are good, and cap refills less than 3, so that's good as well. If we go to our neuro assessment, he's alert and oriented ×3. He does appear restless. Pupils are 3 millimeters, equal round, reactive to light, and Glasgow Coma score of 15. So right now we're most concerned respiratory isn't a concerning assessment, and cardiovascular a little bit concerning too, especially with the hypotension and tachycardia. Based on all this information here, let's determine the top 3 client findings that require immediate follow-up. Today, due to all the information in this video, I will just be going right to the answer. So if you want to answer the question by yourself, just hit pause and then start the video again when you're ready to go through the answer. So dyspnea. That seems definitely concerning. Let's bring that one over for now. Vital signs. His vital signs, he's tachycardic, hypotensive, tachypnic, a little bit hypoxic. So yes, definitely something we want to follow up on. Abrasion to the chest wall. Based on the data here, there's no bleeding, it's superficial, so that seems okay right now. Lung sounds. So we are noticing that he has absent lung sounds on his left side. That's definitely concerning. And then just to rule out, let's look at Glasgow Coma scale, which is 15. That is a normal Glasgow Coma scale score. We got those 3 right. Question number 2. The nurse should recognize that this client is mostly likely experiencing we have cardiac tamponade, traumatic brain injury, and tension pneumothorax. So far we know that we are quite concerned about our respiratory assessment. Let's first look at the traumatic brain injury. We know assessment-wise that he's alert and oriented, didn't lose conscious, didn't hit his head that he knows of, so probably doesn't have a TBI. Cardiac tamponade. When we are concerned for cardiac tamponade, there are 3 things we look for, and these 3 signs are known as Beck's triad. They are hypotension, muffled heart sounds, and JVD. So if you see any of these 3 signs, you want to notify the provider.
If we look at this case study here, he has hypotension. He has hypotension. He has JVD, but the S1 and S2 are present. They aren't muffled. So his 2 of the 3 findings, kind of alarming, something we'll keep in mind for sure. But let's take a look at the third option here, which is attention pneumothorax. We see here that the lung sounds are clear on the right but absent on the left. Anytime lung sounds are absent, we are definitely concerned for a pneumothorax. Additionally, if it's attention pneumothorax, often you're seeing hypotension, which we are seeing, and a tracheal shift, which he also has a tracheal deviation to the right side. And it seems like we have the most data towards attention pneumo. So let's go with attention pneumothorax. Looking at this picture here to explain a little more, you can see that the air is building up in the pleural space here and causing compression on this lung and also the heart and moving the trachea to the unaffected side. There are 2 mechanisms that cause a pneumothorax are closed pneumothoraxes, can be blunt traumas, and in this case, when the client breathes in, air is leaking out of that lung and into the pleural space. Each time they take a breath in, more air is leaking and building up. In an open pneumothorax, it's open from the skin all the way through the pleural space, and that air is coming from outside the body into the lung and increasing pressure in the lung. Question number 3, select the top 2 complications the client is at risk for developing. So we know the client has a tension pneumothorax. We can keep that in mind. Let's start with the top one, sepsis. He doesn't have a fever, no indications of infections, probably not. Seizures, we also know that his Glasgow Coma scale is normal, alert and reactive in his head, so not a concern. Respiratory arrest. We know that his right lung is participating in gas exchange, but his left lung is not because it is collapsed. So he's at risk for respiratory decompensation, hypoxia, respiratory distress. So yes, respiratory arrest is a risk. Obstructive shock. We also talked about how the lung, as the pressure builds up in the lung, it's pushing on the heart and preventing blood flow from leaving, oxygenating the lungs, but also oxygenating the body. So they are at risk for that obstructive shock from the tension from that pneumo. And then hypovolemic shock, no signs of bleeding that we were told, so not a concern at this time. That is correct. Question 4, the nurse reviews the client's lab results. For each potential nursing intervention, click to specify whether the intervention is indicated, non-essential, or not indicated for the care of the client at this time.
On the NCLEX, whenever you are given this option between indicated, non-essential, and not indicated, think about indicated meaning essential. So what are the essential things you do? What are the essential actions you take for this patient at this time?
Administer oxygen. We know that his oxygen is 92% on room air, so this is indicated. Insert an indwelling urinary catheter. This is not indicated at this time. Perform wound care on the abrasion. It is important to do, but not really essential to do, so we can say non-essential for that. Prepare the client for chest tube insertion. Yes, this is essential because that tension is building up in the lung and it can cause, like we talked about, the risks, respiratory arrest, and obstructive shock. So definitely want to get a chest tube in to alleviate that pressure. Prepare the client for a blood transfusion. Looking at the lab results here, hemoglobin is 16, that's normal. Hematocrit's 46%, that's also normal. So not a concern right now. We can say not indicated. That is correct. The nurse reviews the updated vital signs and nurse's notes. Which 3 actions should the nurse take at this time? So let's read what happened at 8:40. So the client is lying supine on a stretcher with his friend at bedside. He suddenly reports worsening shortness of breath. Client has absent lung sounds to the left side with tracheal deviation to the right. His breathing appears labored. Cyanosis present to the mouth and lips. So he has shortness of breath. He has absent lung sounds to the left with tracheal deviation to the right, which we know his breathing's labored. But now he has cyanosis as well. And looking at vitals, we have a new set of vitals. So they are now more tachycardic, 148. Respiratory rate's 32. They are hypotensive, 88/62, and their pulse ox is 86% on room air. So right now, they are not doing too well, and we are concerned about their respiratory status. So with that in mind, what 3 actions do we want to take at this time? Insert a peripheral IV. maybe, but maybe not the most important. Administer pain medication, probably not the most important right now. Administer supplemental oxygen. Yes, they are 86% on room air, so definitely do that. Notify the healthcare provider. Yes, we want to notify the healthcare provider and alert them to the fact that this client's cyanotic, has labored breathing, has tracheal deviation, and absent breath sounds on the left side. And then administer an albuterol breathing treatment, not really indicated at this time. Raise the head of the stretcher to semi-Fowler's position. Yes, this is important because we need them to oxygenate better. We need them to oxygenate as best as they can right now prior to us getting that chest tube in. Question 6. The client was admitted to the ICU following chest tube insertion. The ICU nurse records a brief admission assessment at 9 o'clock in nurse's notes. Which admission assessment findings indicate improvement in the client's condition? Select all that apply. Trachea is midline. That would be an improvement because the tension pneumo is no longer causing that pressure and moving the trachea, so that's definitely good. Pain of 10 out of 10? Not quite. Still quite a lot of pain. Respiratory rate of 23. That is a lot better from 32 and 26, so that would be good. Blood pressure of 106/70. Although that is still low, it is better than 88/62. And then diminished lung sounds on the left side. Even though they are diminished, we now have lung sounds on the left side, whereas previously they were absent, so that is a good finding. Continuous bubbling in the chest tube water seal chamber. Continuous bubbling can indicate an air leak, so we'd want to notify the provider if they don't know and make sure they are aware that the chest tube may have an air leak. So that would not be a finding of improvement. All right, guys, so now I'm going to show you how to gain access to this incredible study tool. So the first thing you want to do is go to bootcamp.com/NCLEX. Then when you get here, you will want to go to upgrade. From there, you will click on the Get 3 months access. Once you get to this page, you will click on that you have a promo code, and you will type in Nurse Kaylee. And you will see that the amount goes to $0. You will then hit Proceed. Once you have created an account, it will take you to the bootcamp.com. Likely you'll come to this home page here. So I just want to show you a couple of things that I really like about this site, and I think you'll enjoy as well. So the first thing here, you can see on the left side the next gen cases. We already went through one today. We went through case study 37 here. This was the tension pneumothorax in the subset of critical care. But there are 42 total case studies. So there's a lot on mental health, maternal and newborn health, child health, and then adult health as well. So there are a lot of case studies that you can practice and work through the next generation NCLEX style of questions. When you're going through these case studies, they have video explanations with each question, so you can watch those to understand the correct answers, and then also written explanations as well, so you can read through to understand more about why the correct answer is correct, things like that, to help you learn as you're studying for the NCLEX. Then the other thing I want to show you, you can go to the next gen standalone questions, and here you can create your own tests with each of the categories and select how many questions you want. And then you are able to practice these standalone questions. For example, the bow tie is a new standalone question on the next generation NCLEX. So that is one that you can practice here. The next gen course, this is a course, so you can see number 1 has next gen NCLEX the basics. So there's 3 lessons talking you through the basics of the NCLEX, what you need to know. I found them really helpful. You learn a lot. And then also how to approach a case study, and then full case and question walkthroughs, kind of like what I was doing today, walking you through a case study. There are 2 listed here as well. The next thing over on the left here is a study schedule. So you can click on that, and then you can access a 8-week study schedule, and it's a plan of how you can work through studying for the NCLEX, which I find super helpful, especially as you're beginning studying and you don't really know where to start. You can kind of use this as a guide and to learn how to study. So I definitely recommend you guys use the promo code. There are only 20 available, so hop on and grab yours. And thank you so much for watching this video today. I'm Nurse Kaylee, and I'll see you in the next one.